Hello, I'm Dr. Phillip Myers from Nexus Eye Care, and today we're going to be talking about ocular allergies. And I have with me today Dr. Kiran Sindhu, one of the comprehensive ophthalmologists at Nexus Eye Care. Hello, Kiran.
Hi, Philip.
Kiran, how common is eye allergy?
Look, it's a very common problem. In the Australian population, up to 15 to 25% of people suffer from eye allergy. And in fact, it's one of the main reasons why we, as patients, have to go and see our own GPs. And up to 3% of consultations are actually just for eye allergies. So it's a significant burden to the health system as well.
So eye allergy is a broad term. I assume there's different categories of diagnosis.
Look, there is a lot of different subtypes of eye allergy. We all think eye allergies as eye allergy, but in fact they can range from common self-limiting conditions to more serious conditions, which are, although rarer, they can actually be sight-threatening. So I broadly would divide them into 5 subtypes, starting off with the commonest one, which is a condition called allergic rhinoconjunctivitis. As the name implies, it affects more than just the eyes. It also affects the nasal cavity, and that's by far the commonest cause. Fortunately, it's usually self-limiting, and in itself it's subdivided into what we call seasonal or perennial subtypes. Seasonal means it's more common in certain seasons of the year, and perennial means it's year-round. So the second subtype and the third subtype that I'll talk about are the more serious ones and affect the eyes in a greater way and can have long-term side effects and complications. One is vernal keratoconjunctivitis. That tends to affect more children, and the hallmark of that is they often get a stringy discharge that they can actually pull out mucus strings, and that's a hallmark for that condition. The third type is called atopic keratoconjunctivitis. That's another level up in seriousness. And as the name suggests, the word atopy means they're prone to all sorts of allergies. Simple ones that we've probably all heard of include hay fever, asthma, and also eczema that affects the skin. There's also a condition called atopic dermatitis, which is a more severe form that also affects the skin. The fourth subtype that I want to touch on is something called giant papillary conjunctivitis. This is usually secondary to some sort of irritant on the surface of the eye, causing a foreign body type reaction. So most commonly it's seen in soft contact lens wearers, but it can also be seen in someone who's had previous eye surgery. They had some stitches and they either were taken out or they've broken, and that can irritate the upper lining of the eye, the inner lining of the upper eyelid. And the hallmark for this is they also get a yellow discharge from the eyes that you can pull out like strings, but if you actually turn the lid inside out, they get a cobblestone appearance. It's a very unusual appearance to the eyelid, and that can be quite irritating. And the fifth subtype is, we must always remember that medications that we put in our patients' eyes can also be a cause of allergy, so they can get an allergic conjunctivitis as well.
So a very comprehensive summary of the different types of allergy, which is just useful for patients to know about and useful for their referring GPs and optometrists to hear. But it sounds like it takes specialist equipment that we would have here to be able to detect some of those different sub-varieties of allergy.
I think that's correct. Obviously history is important, but certain examinations like we've touched upon, looking underneath the top eyelid and looking the surface of the eye and looking for complications of eye allergy, we really need the specialist equipment. So going to specifically, I suppose, and when I see a patient, to try to arrive at what type of allergy they have, the history is important. So we've talked about the commonest condition, which was allergic rhinoconjunctivitis, and I talked about being seasonal or perennial in types. So we talk about seasonal, as the word implies, certain causes are more common in certain seasons. For example, in spring, it tends to be more tree or flower pollen. Summer tends to be more grass. Autumn tends to be more weed pollen, and winter tends to be more mold that grows around in the house. So they're all the seasonal types. The second subtype is the perennial type, which, as I mentioned earlier, is a year-round problem, and the most common cause for this is dust mites inside the house. But don't forget, unfortunately, some people are allergic to animal dander, which includes our pets.
Some people think that having dust mite in the house is a sign that they're not very good at keeping the house clean. Is this a remark on people's hygiene?
I don't think it is. It's a lack of, I suppose it comes down to keeping our houses all enclosed, keeping it protected from the sun. So we just, and we'll talk about that later on when we talk about what treatment options we have. But no, it's not poor hygiene, and it's not poor diet either.
So what are the symptoms and signs of eye allergy that you look for?
Again, on the history, I think the most critical symptom that I ask for is itchiness. That's a preeminent symptom of any allergy. And specifically for the eye, then there'll be the other usual things which aren't always specific. You can get a watery eye, you can get a red eye, and it may not be the whole eye that's red. It might actually be a rim of redness around the edge of the white part of the eye called the sclera and the cornea. They just get a ring of redness, and that's typical of vernal keratoconjunctivitis. They can get swelling of the surface of the eye, the conjunctiva. They can get swelling in the eyelids as well. And of course there's discharge, usually watery, but in certain diseases, we've talked about the mucoid discharge that they can pull like strings.
That's really helpful to know what you look for to make the diagnosis of allergy. Once we know a person has truly got an eye allergy, what are the treatment options, and maybe what can they do at home to help minimise these allergies?
Good question, Philip. For good or bad, I unfortunately suffer from allergy myself, so a lot of the principles that I apply to myself, I impart on my patients. So I divide into simple things that's ready available. Obviously, if you know what you're allergic to, try to avoid it or minimise exposure to it. But otherwise, simply rinsing your eye with cold water, you help wash out the allergens, and the coldness also helps you symptomatically. I have a little ice pack that I keep in the freezer, and when I'm in real trouble, I whip that out and put that on. We can also then, so they're easily available, no medications involved. The next stage, of course, is medications, and that can either be dropped directly in the eye or medications you take by mouth or injections, and a lot of that will depend on the severity of the condition.
We're going to talk about medications that you might get at the chemist to help with eye allergies, what works, what doesn't work. Kiran, going from simplest through the different ranges that are available, what works for eye allergies?
I think that the simplest and most readily available one, which is again available over the counter, is just simple lubricating drops, artificial tie. It won't help you symptomatically straight away, but it will certainly help wash out the allergens. The next level, which is more specific to deal with the allergy, is some form of antihistamine drops. The third type of medication are a medication called mast cell stabilizers. Mast cells are little cells that are found on the lining of the eye, which discharge their contents, which are special chemicals that result in all the symptoms that they get, the itchiness, the redness, the swelling. So if you can use drugs that stop those cells discharging their contents, that's how they work. Fortunately, nowadays we actually have medications that combine both the antihistamine and the mast cell. So two of the commoner ones that I use, one is called Zaditon. This one you can actually get over the counter, And the second one is another one called Patanol. That one, though, requires a script, and they have multi-modes of actions to help patients symptomatically. Unfortunately, there are more severe forms of allergy, and we've touched upon both vernal keratoconjunctivitis and atopic keratoconjunctivitis, where these simple medications aren't enough, and we need to go to higher level medications. We can include steroid drops or another set of drops called non-steroidal anti-inflammatory agents, and then the most severe forms may require what's called immunomodulatory treatment. These are new types of treatment that modify the way our immune system works or overreacts, and we try to numb it down. So they're the medication you can put in the eye. We've talked about medications you can take by mouth or by injections. So the most common one is antihistamine tablet. So that's what I do when I get an attack. I get my ice pack out and I take an antihistamine tablets. We're fortunate that nowadays we have very good antihistamine tablets which have a long duration of action and are non-sedative. For the more severe cases, this is where the immunotherapy can come in. This is particularly for people with atopic keratoconjunctivitis, where the main problem is actually the skin disease, and they can often need immunotherapy to be.
Sometimes steroid drops are recommended by the eye specialist to treat allergy. Kiran, many people are concerned about taking steroids. Is there a problem with them?
Look, it's quite right to be concerned about the use of steroids. We always worry about probably three things that it does increase your risk of. One is glaucoma, putting the pressure up in the eye. Two is getting cataracts. And three is it does increase your risk of getting infections, whether it's a bacterial infection or a viral infection like herpes.
So we need to talk to your doctor about steroids if you've got any concerns about using them long term.
However, I'd also like to add there are certain conditions, though, that will not get better unless you actually use steroid drops. So it's like anything in life, it's a balance of risks and benefits. One of the big reliefs that we as patients who get allergies is to rub our eyes. And unfortunately, it might be soothing at that particular time, but it actually perpetuates the symptoms. And worse still, chronic rubbing of your eyes can result in complications to the eyes. One of the conditions that we worry about, and it's one of the big risk factors for this condition, is a condition called keratoconus, where your cornea becomes conical shape and you suffer loss and distortion of your vision. So it's important not to rub your eyes if you can help it.